This is about something affecting the colon and there with defecation. Irritable bowel. By it, the symptoms are that the people have urgent but painless diarrhea during eating or directly after eating or in the morning. And there are also some people who have a continuous aching pain in the lower left side of the abdomen, and some people have alternating constipation and diarrhea. Now, the symptoms are that the muscles of the lower colon are overactive. And the causes of it are named in this book: stress, anxiety, depression, tension, and so on. And the idea in this book here is then to try not to be stressed, to try to be relaxed. Also, it's been multiple times said to do exercises. So the idea is basically to relax and not to try to be self-imposed stressful, and try to avoid stressful situations where other people are stressing you. That is basically advice here in this book. By Keith Watkins, named Family Medical Advisor on the page 95. If you click this video away, then please tell me what the reason for it was so that I can improve. Otherwise, hi, welcome. I am trying to learn medicine. Today, irritable bowel. And after we've done that, we're gonna do extensor carpi ulnaris strength training. The extensor carpi ulnaris lies here. And if you participated in the extensor carpi ulnaris strength training, then it's at your risk. And we're gonna talk about internal anatomy, digestion, defecation, and stuff like that, diseases. And this is no medical advice. I'm just trying to read the text, try to understand it. Irritable bowel. A disorder of bowel action, usually starting before the age of 30. It is also known as spastic colon. Okay, the bowel isn't probably working. I don't even really know what the bowel is. Symptoms. Some people have urgent, painless diarrhea during or after meals, or immediately on getting up in the mornings. So they have to go urgently, but painlessly, already during or directly after they have eaten, or directly when they get up in the morning. Diarrhea. Other people have colicky or continuous aching pain over the lower colon in the lower left abdomen, with periodic constipation or diarrhea, sometimes alternately. I don't know what colicky means. So some people have also aching pain over the lower abdomen on the left side, and then also periodic constipation or diarrhea, and sometimes one and then the other. Passing mucus with the stool is common. Okay, so also passing mucus, and they also have oftentimes tiredness, lack of concentration, anxiety, and depression. We had that in the past, but we had one idea of something which causes anxiety, which is completely physiological. And here we had something. It could be that an irritable bowel causes a person to have anxiety, but as it reads here, it could be that just the completely psychological, completely physical thing, physiological thing causes the anxiety to be. Duration. Individual episodes may last from days to months, and episodes may come and go for years. Causes. Stress, tension, anxiety, or mild depression causes the bowel to react by overactivity of the muscles of the lower colon. What is the causing what? Stress, tension, anxiety, or mild depression causes the lower bowel to react with overactivity of the muscles of the lower abdomen. It reacts with the overactivation of the muscles of the lower colon or the Okay, it is the stress, tension, anxiety, or mild depression causing it. Treatment in the home. Remember that it is stress, often self-imposed, that causes the symptoms. So relax and try to avoid stressful situations. Occupy yourself with alternative activities, especially physical exercise. Try bland bulk building agents and recommended doses, or bland 1 tablespoon 3 times daily. The book is from the 70s, so maybe there are new ideas, but it may be also from something else, and the person just is not just relieved through changing their mindset about it, through remembering that it is stress, which is just self-imposed. Now, when to consult a doctor? If you have troublesome or persistent symptoms, if depression or anxiety is marked. What the doctor might do: give advice about diet and exercise, prescribe drugs to reduce overactivity of the bowel muscle. So drugs to reduce the problem is overactivity of the bowel muscle. I don't know what the bowel is. Treat any anxiety or expression. If he or she has any doubt about the diagnosis, he or she will send you for X-rays and stool investigations. Prevention. Take plenty of exercise. Take plenty of exercise. I just find it strange. But there is something, and the prevention is plenty of exercise. And the other thing, avoid stressful situations that are known to cause symptoms. And outlook, the tendency is usually lifelong. I don't really know what I should do with this information. Ending with it is lifelong. But they're saying maybe it's lifelong, the tendency, but not the happening. That is what they're saying. So the people have tendency to have these problems with it. They're having diarrhea immediately, urgently, oftentimes, directly after eating or during eating. Also passing of mucus, tiredness, lack of concentration, anxiety, and depression. I say if they are able to do a lot of exercise, they should do it. They're saying they should try to be not stressed. And there are also drugs to reduce the activity of the muscles in the lower colon. And with that, it shouldn't happen so much. That is the idea. Okay, we've read it. Now, I think that is the first time that we did that. This irritable bowel. That means we're not going to do a presentation now about irritable bowel. That means we're going to come back to a second time. We're going to read it all again. Then we're trying to memorize what is said there. We're going to read it in detail and try to really understand the things. And then we try to do a presentation. That means if you were here for medicine, you can already do the next one. Medicine. Then we're going to do a whole thing again. If you stay here and participate in the extensor carpal tunnel strength training, that is a little more risk. The feet are standing shoulder wide apart, a bit more good and still. Hands next to the body, the fists, and bring them down and up. And again down. And we're having 3 rules. The first rule is that we're stopping immediately as soon as there's pain. The second rule is that we're going only as far as we can go with a little bit of effort. And the third rule is that we are not overdoing it. We just want to strengthen, not to exhaust. And the next exercise, fist like that, and up and down. The counterfeit money check exercise. And now, the next exercise with a t-shirt, a towel, or a sock. Press onto it and bring the wrist again down. And again down. And up. And away. Press and up. And now strong press again, good, with all 5 fingers equally and turn to the outside. Only as fast as it goes, painless. And again. And on the other side, press good and to the inside. And outside. And on the other hand, from top down and down. And again down. Other hand, on top and down. One more exercise, just press equally with all 5 fingers. On the other side. And that was the extensor carpal. Now it's time training. Thank you very much and